Here at Michigan Family Wellness, we believe chiropractic care and nutritional-based therapies are a foundational part of a healthy family lifestyle. No matter where you're at in the mitten, having a family is such an exciting time of life. So instead of feeling overwhelmed by stress, fatigue, and responsibilities with the kids, we invite you to become part of this empowering community to create happy, healthy families. By providing engaging interviews and practical applications, Dr. Wallner cultivates family health by equipping our listeners with the tools they need to elevate wellness in their own family. Dr. Wallner passionately serves the Michigan community at his chiropractic and nutrition-based practice, where he specializes in pregnancy, pediatrics, and family wellness care. And now, here's your host, Dr. Kyle Wallner.
Good day, families, and welcome home. That's right, my name is Dr. Kyle, and this is the Empowering MFW family, and we are so glad to be with you today. If you are joining us for the first time, I want to thank you for tuning in. The health of you and your family is your number one priority. It is your greatest asset. The best way to have a healthy family is by living a family wellness lifestyle. So, if you're looking for efficient, effective, and sustainable ways to elevate your health and the health of your family, then I strongly recommend you make yourself comfortable because we have an amazing show for you today. And before we get to today's episode, let me say a few words as I do every week about Power Performance Gym. Power Performance Gym is dedicated to helping you achieve your best definition of healthy and strong. Power Performance specializes in strength and conditioning for individuals, small groups, and athletic teams, weight and pain management, as well as recovery and nutrition. Everyone at Power experiences a full movement and health analysis to build your blueprint for success, targeting your goals. Mention the Michigan Family Wellness Podcast to receive your movement and health analysis as a complimentary gift. Learn more about how Power Performance can help you move, look, and feel better by visiting powergym.com. That's POWRGYM.com. Ann Margolis is a licensed certified nurse midwife, OBGYN nurse practitioner, and certified yoga teacher. She is a third-generation guide to mamas birthing babies in her family. Ann has helped thousands of families in her 20-plus year midwifery practice and has personally ushered the births of over 1,000 healthy babies into the world. She has midwifed mamas and babies for over 2 decades, with her clients describing her as passionate, sensitive, big-hearted, and a playful ball of light. When she's not helping mamas around the world, you can find her doing yoga, dancing, traveling, enjoying family time, and watching comedy. All right, families, let's welcome Ann.
All right, good afternoon, families. Once again, Dr. Kyle Wallner here to bring you an empowering interview all about the benefits and value of midwifery and chiropractic care as it relates to the women in our lives who are expecting. So pregnancy, so our expecting mothers, this is such a vital and pivotal point here of the Michigan Family Wellness Clinic. We really need to support the women who are in this season of life, and there's no better way to do it than with chiropractic care and combined with a certified midwife. Good afternoon.
So nice, so exciting.
Yes.
Good, how are you?
Hey, we're doing great. We are here this afternoon to talk about the benefits and the value of not only chiropractic care, but also using a midwife for your pregnancy. Whether you're currently pregnant or whether you're thinking about starting a family, this is going to be a great discussion, a great conversation for people who are currently pregnant, or if they're like, hey, what is midwifery? What is a doula? Ann's going to help us answer all those questions and give us a better context for those natural, healthy births. That being said, and the 2 things that we always ask on the Michigan Family Wellness Podcast here, and the first one is, what does family look like for you?
Oh, well, today family could be anything. You know, it's my family is, I am married with 4 children who are now grown. And I'm all about kind of bringing back the village, because so many women today are alone. You know, It used to be we were in tribal or communal living, you know, and women were, it takes a village to raise a new baby. Everybody knows that, but it takes a village to raise 2 parents and human beings really to thrive. So what I'm finding today in the modern world, especially, is so many people have been spread apart, and women are, more alone or not necessarily getting along with their blood relatives. Mm-hmm. And even if they are getting along with their blood relatives, the blood relatives are not necessarily supporting their choices. right? So I encourage everybody to create your tribe, and those are people who have your back, you have their back, who you're like-minded with, who inspire you, who you inspire, like a sisterhood, brotherhood. It's like creating your tribe that may be extended family, that may be close friends or other people in the community.
That's brilliant. Again, here at the Michigan Family Wellness Clinic, we believe in creating and cultivating thriving, natural, happy, healthy families. And one of the ways that we do that is through the work that we do here in the office, the chiropractic adjustments, the structural care, the nutritional care, but then also educating our community on all of the other avenues that are parallel with that mission and vision. The second question that we always ask all of our guests is, have you ever been to Michigan? What's your favorite part about the Mitten?
I certainly have been to Michigan. I applied to University of Michigan, and I thought I was going to go there. When I initially, back in high school, I was in 11th grade, and I, like my 11th graders, didn't have any clue where I wanted to go to college or what I wanted to do. And so my aunt actually took me around to different colleges, and I fell in love with University of Michigan as one of them. But I loved it. It was really, everyone was so friendly, and it was just, it was very different. I grew up in Philadelphia, so very different feel.
Right.
I loved the campus, and it was just, everybody was just so friendly.
Yeah.
And into sports, very athletic.
Very much
like
so.
The team spirit.
Yep. Yeah. Especially right now with the football season starting, U of M football. Obviously I'm biased, but my wife and I, we love the state. There's just so much to explore with it. We've lived in the Lower Peninsula for the longest time, but we've loved exploring more of what's called God's country, in the Upper Peninsula. So yes, if you ever happen to come visit us over here again, it'd be wonderful to catch up and grab a coffee or tea.
Oh my gosh, I wish we had more of your practices near here.
Brilliant. That being said, Anne, we want to actually jump into some meat and potatoes for this conversation, because some women out there may be listening or watching us, on the live or the replay, and they're like, what is a midwife? What is a doula? So before we get into some of the other things I want to ask you in relation to your story, can you just quickly give us some context and some definitions? What does a midwife do, and what does a doula do within the context of pregnancy or preconception, things like that?
Okay, so let me just start by saying, just in case anyone, so we can have a context, is that an obstetrician is basically a surgeon and OBGYN, and specializes in high-risk situations around pregnancy and birth, and gynecology, and they go to medical school, and they're trained to look for, and with all sorts of diagnostic testing and screening, look for and treat medical and surgical complications, and treat them with medical and surgical treatments, right? And so we need obstetricians. The issue today we're finding today is that when the vast majority of the population is healthy, right? So having a baby is as healthy as breathing. If we're healthy, our bodies know how to breathe, our heart knows how to pump, and our bodies know how to have a baby. So a midwife is actually an ancient profession, but it's now a combination of science, evidence, and art. And it's really in New York. We have to be a master's level training and nursing. I have a bachelor of nursing and a master's in midwifery. So we have extensive training, in preserving. And the philosophy is birth and pregnancy and women are normal until proven otherwise, as is their baby.
Right.
We can screen for problems, but we most of the time are holding space for the women and baby to grow and birth. And we can manage, complications and emergencies. And if something is out of our scope, we can certainly refer. And so it's a really brilliant team between a midwife and an obstetrician, because my first job was a doctor midwife team care. The obstetrician just says, call me when we're having a cesarean, call me if you need an insulin to, have somebody who's on insulin, or call me if someone's very high blood pressure. Otherwise,
Gotcha.
The women benefited from the midwifery care, which is how to support women and their families having a normal experience, returning the humanity to it, returning the celebration to it. Can we invite pleasure and beauty into the, returning to that, right?
Absolutely.
A doula. So a doula, getting back to the village problem we're having here, is a lot of families don't have a village.
Right.
Is that in throughout the world and throughout history, women have been supporting women in labor, and as new moms. And so it could be sister, mother, mother-in-law, aunts, friends. All the women in the community would come together and help each other. And today, like I said, a lot of women are alone. So a doula is basically someone who takes a weekend or not very a long course. They're not medically trained, but they're serving to mother the mother. And some of them, learn really good, emotional kind of labor support techniques. And, we learn that as well as, in midwifery school. But I love to work with a doula, especially if somebody is alone. They have their partner, but the partner doesn't necessarily know what to do. Right.
Right.
And so there's a big difference. Like they're so essential for so many people. If they don't have that mother to mother them, or a sister to mother them, or a friend to mother them in labor, when a woman is most vulnerable, but also most powerful.
Absolutely.
Right? So
I love that language you use there. I've never heard it described in that way, or I've never heard it articulated in that way. So you're saying that a doula would almost mother the mother, and I think that's beautiful. I think that's completely
exactly what they do.
That's necessary. So again, kind of a theme as we've said before on the Michigan Family Wellness Podcast is almost a healthcare team. So it's not like chiropractic is always the answer, or acupuncture is always the answer, or massage therapy is always the answer. So in the context of pregnancy, a midwife, a doula, a chiropractor, all of these different professions play a role in cultivating that healthy, happy pregnancy. So thank you for articulating those differences. What I want to ask you about now is, if you don't mind, sharing a little bit of your story. I understand you have quite the story, both with your pregnancy and postpartum.
My first job as a nurse, actually, when I was in nursing school at University of Pennsylvania, when I did my obstetric rotation, I'm like, that's what I want to do. And we learned all about natural childbirth, and I thought it was beautiful. My first job as a nurse was actually it was very scary. That's where I developed fear of birth, because I was a nurse kind of rescuing a lot of the problems from the interventions that were being done to just normal women walking in labor into the unit. And I saw some of the worst outcomes, and they were really scary. And I saw way more cesareans. I never saw natural birth. I never assisted in a natural birth. And I had to resuscitate a lot of babies. A lot of babies were ending up in the intensive care unit. So I was scared. And when I was 23, I was expecting my first baby. I didn't know about a midwife. We didn't have internet back then. And I was just like, I'm a dancer, and I'm very athletic, and I was very scared of being cut and general anesthesia. And, so I came in already with fear. So that's already kind of the enemy of labor, is to be afraid.
Right.
And how do you labor well when you're afraid? So of course, and then of course, I had all the standard interventions. I was put on my back, not allowed to eat and drink, tied to a monitor, had an IV, and any animal cannot labor. Their body cannot function in that, usually well under those circumstances. Any animal that's afraid will stop labor. So certainly, and also like physically, that if a woman is on her back, the pelvis is smaller. The pelvis is, 3 bones connected by ligaments. It's very physiological. The use of gravity in different positions. Now I know to widen the pelvic diameter to help the baby to help the cervix, the opening of the womb dilate, the baby to be born. But I didn't know that then, right? So I remember the doctor kept coming in because they have a time limit. You have to dilate a centimeter an hour. And he kept sticking his hands up in me and he's saying, you're still 4, you're still 4, you're still 4. And he walked out and I heard him tell my colleague hang Pitt outside the room. Well, I knew what that meant. I'm a midwife. I know Pitt. I mean, I'm a nurse now. So Pitt means Pitocin. So I was doing Lamaze at the time. The doctor the nurse comes in and starts putting Pitocin in my IV. And I said, I don't want that. She says, oh, but honey, you don't want a cesarean, do you? So then, no, I don't want a cesarean, so I was kind of like feared into the cascade of events, which ultimately then the contractions, the sensations were too painful. Lamaze went out the window and I needed an epidural. So then that happens.
Which stresses the baby.
That's exactly what happened. Her heart rate my daughter's heart rate had they call severe bradycardia, which is the heart rate went down very low. And they called for a stat emergency section. So here I was, my biggest fear was happening to me and I'm being wheeled in and it's this crisis, like on the ER show or something, and I'm being wheeled in. Now here's a stat cesarean called and I am in the OR by myself. And then it started to look like an hour as they were waiting for the assistant surgeon. I was alone. Nobody was monitoring my baby. Now I was convinced I was having a damaged or dead baby. So I was in the trauma and then somehow the epidural relaxed my body and I started pushing. I got to full dilation and I start pushing.
Gotcha.
And I called for help and the doctor comes running in, get me a vacuum. And it's this whole crisis. And he cuts a big episiotomy and he suctions her out.
Right.
And I didn't want to see her.
Yeah.
I thought I couldn't handle, like she was not alive and she was fine. Like she was breathing. I'm sure she was traumatized too.
Yeah.
But, I was not fine. So that was my first experience of birth. So of course that was, now I know, is birth trauma. And I was afraid to have another baby. My husband wanted another baby. 2 years later, I'm pregnant again. And I didn't know about midwifery, but I knew that something had to change. Something was different. I was really passionate about helping moms and babies. So same kind of thing. The doctor, when I was in labor with my second baby, so the doctor sticks his hand up. He walks out. He's a colleague of mine, a doctor I work with. He walks out and he doesn't even tell me. He says to the nurse, I could hear, prep the OR. Baby's too high and posterior.
Okay.
Now I'm a midwife, right?
Yeah.
Now I know. A lot of babies who are high and posterior can come down. Like, get up.
Sure.
Put you on your hands and knees. You can use different positions.
Exactly.
I've delivered before, so my body knows that. Anyway, so I called him back and I said, please do. I don't care what you need to do. I'm not having a cesarean. My body birthed before. Like, turn her.
Yeah.
And he said it's going to be painful. I said I don't care. So that was an agony. He stuck his hand up and he turned her manually. But I was expressing my, and I had, so then I had her vaginally. I was expressing my frustrations and with a friend of mine who was in midwifery school. I didn't know it.
Right.
And she's like, why don't, because I was like saying I was having to, I'm not, like it's just like birth doesn't have to be this crisis, like a fear of a lawsuit, a fear of a disaster, like something is wrong here. And I feel like I'm constantly trying to rescue a lot of the problems from these interventions. And I'm just, so she says, you should be a midwife. And I'm like, what's that? And that's where, so that was in 1989. And she started explaining it to me. I went to the library. I'm reading and it's like, I'm so thirsty. I'm just reading this. And then I applied and I came home. I absolutely came home when I was in midwifery school because it returned the humanity and the normalcy to a beauty and the beauty to and the celebration. And then it became more the norm to see normal, beautiful births and experiences that the mom and the father or the partner were having and the baby, such a gentle entrance into the world. And a cesarean and medical interventions, which are needed sometime, became more of the exception, the rare exception.
Right.
And it totally like flipped it. And I was like, this is me. This is me. But when I got pregnant again with my third in midwifery school. And I of course believe now, in the midwifery model of care. but it wasn't in me. I said to my midwife, this has to work for me to authentically promote it for everybody. And she said, oh, you'll be fine. You'll see. It's so different. And oh my gosh, she was so right. Like, it was the most beautiful, inspiring, ecstatic birth. Yes, challenging, but I was so healing. If I could do it, anyone could do it. Any mom could do it. So now, that was my entry point, and I'm still very passionate about it.
Yeah. And that's why I just feel so strongly, and thank you for that, by the way, Anne, for your vulnerability, for sharing your story. But I just feel so strongly that more women need to hear inspirational messages like this, encouraging messages like this, because there's just so much out there these days that can be applied to wherever that woman's at. We're not saying that all of the women today should be giving a home water birth or anything like that, but we're saying there is an alternative to the, let's say you're having a perfectly normal birth, but you're in that hospital setting, and then you're at term and the baby's not coming, and then they start doing the Tosin epidural cycle, and then, like I said, like you were saying, a completely normal birth turns into a stat cesarean section when it's like, whoa, what's going on? What just happened? There's so much that can be done naturally. There's so much that you can do with birth directives, and I just highly encourage you guys to not only check out the numerous online audio library that we've had where we've talked about all of this in detail, but I also wanted to mention I just had a new patient recently with what's called SPD, symphysis pubic dysfunction, and mentioned the 3 bones of the pelvis. And this is actually pelvic dysfunction with that pubic symphysis joint, and significant relief from that pain, from that abdominal tenderness, from the pain in between the thighs, from those natural conservative chiropractic adjustments. So again, I can't emphasize enough the importance of the structural care as it relates to chiropractic, as well as working with a trained, certified midwife who really knows what they're doing. And again, to your point, Anne, there's a reason that we have those interventions in place, like you mentioned. Because women and their babies have lost their lives. Let's just be honest. There's a reason that we have those interventions. But if we can avoid all of that, if we can prevent all of that, that's what we're all about here today.
In terms of, our country ranks among the lowest, on the bottom, as compared to other industrialized modern countries in terms of losing more moms and babies in childbirth now. And that is because of a lot of these risky interventions applied to healthy women and babies. Mm-hmm. So, and our cesarean section rate is 30% nationally. Where I'm living, it's could be 40, 50%, depending on the hospital. That's unacceptable. Yeah. Right. So my name of my business is Home Sweet Home Birth, but it's bringing the model of home sweet home, in the freestanding birth center, in the hospital, or in the operating room. Yes. We can restore humanity and beauty and informed choice and dignity to this process. Yep.
And furthermore, this goes back to my theory of why women are going to save the world. So if you'll indulge me for a few moments, I talk about this a couple of times on our platform here, but this is really it, Anne. Women are literally going to save the world. Men got us into all this trouble, right? And women are going to fix it for us. And the reason why they're going to do that is specifically because, as we've been talking about cesarean sections, when babies are delivered via C-section, they don't get their microbiome. They don't get that privilege.
One of many problems, yeah.
Yes, the privilege of going down the birth canal to really seed their microbiome. Now, there's so many things you can do. Breastfeeding is fantastic. Probiotics, prebiotics, all these things for the kids. But as you said, there seems to be this rise of cesarean sections. And I'm not saying there's causation, but there's definitely correlation between the rise, let's do it this way, the rise of the childhood mental cognitive disorders. So again, not saying causation, but certainly correlation. And so that's another thing we look at here at the Family Wellness Clinic is how can we support women and babies in their microbiome for these best outcomes? Because here's the thing, the insulin levels from the mother are transferred to the baby. So if we want to reverse the trends of skyrocketing metabolic,
as are the stress hormones.
Yep, exactly. We get all of that from our mother. So that's why women specifically are going to save the world. because there's so much we can do in terms of lifestyle and prevention, but we have to apply that to the young women who really aren't even pregnant yet so that they transfer good genetic information to their kids. Now, yes, epigenetics and all that conversation, yes, but the insulin levels of the baby, we get those from our mothers. So we have to educate these women about how to live healthy and thriving lives.
Changing hospitals and changing doctors and nurses and hospital institutions, that's hard. Empowering women and their families to speak up is so much easier, and that's going to make the change. Like I have this Love Your Birth online course for any,
Sure.
It kind of brings women, as I bring women through my practice through the pregnancy and birth, postpartum, to have the most healthiest mind, body, heart, and spirit experience as possible, and to love it and embrace it, no matter how it unfolds. But a woman, I got a letter. I mean, it's amazing. I got a letter from a woman who lives in Central America because her husband is stationed there, and she was pregnant. She took my course, and she felt empowered enough with that information to go. She could not find. There's no midwife or doula there. She only found obstetricians who only did cesarean birth, and there are some countries like that. And she got this doctor. She from this course, she was empowered to convince this doctor who only performs surgical birth to attend her naturally.
Okay.
And that's just from speaking up. And and he was changed forever. Like the ripple effect of how that's going to be for not just her family, but for everybody he takes care of. Yeah.
Yeah. There's one other thing I wanted to mention, and in regards to the postpartum context, the hormone relaxin, as you know, really prepares the mother's body for delivery. And the point that I want to mention here is that hormone actually disappears from circulation very quickly after delivery, after birth. So this is a major deal when you consider if there's any kind of segmental dysfunction of joint misalignment, whether that's, during the birth process or even leading up to, perhaps during the pregnancy, those joints, that osseous alignment is going to really lock down when that relaxin hormone disappears from circulation. So this is why it's very important to be checked by a chiropractor postpartum, and then you start educating them about the benefits and value for pediatrics. So have you seen anything like that? Does that kind of make sense or resonate with what you've seen?
Oh my gosh. I would say almost all of the families in my practice are seeing a chiropractor and osteopath. Yeah. I mean, it's huge. I mean, I use it a lot. I sing your praises. I think it's so important. It affects, everybody thinks, what about the spine and the pelvis? But every our whole bodies are affected by all the nerves that go up and down.
Yes.
I don't have to tell you that. But I mean, I've had such success with all sorts of discomforts that women have with babies that are breech, the Webster technique.
Yep. Webster
with the syphilis SPD, what you were talking about. Yeah. I mean, with nursing, especially like a baby who's colicky and is having trouble with the latch. I mean, oh my gosh. I mean, that can be when they're misdiagnosed as having a tongue tie, and it's really they just need a little adjustment there. And it's very easy to adjust babies, as you know, because their skull's not, ossified yet.
Exactly. Well, let's just, as we start to round out our discussion here, let's just jump into some practical applications. And in order to do that, let me set up a framework for you. So let's actually go with that example. Let's say, we have a pregnant woman and she's having some lower back pain, some abdominal pain, and some pelvic pain. And my question for you is, as a midwife, what could be some practical things that she could do perhaps at home that would really help to manage that or to decrease that pain that she's experiencing?
Well, first, anytime someone comes with me for pain, I always, do a thorough evaluation just to see, what I feel could be causing it. Because if someone's having back pain, it could be a urinary tract, a bladder infection, a kidney infection, for example. But like if I feel it's sort of the kind of normal aches and pains of pregnancy, Aside from telling a woman to go to a chiropractor, an osteopath, I love the belly binder. It gives support, because especially for women who it's their second or third or fourth pregnancy, and they're and they haven't necessarily done dance or yoga or Pilates in between, so their abdominal muscles are a bit like lax. So the belly binder sort of lifts the belly up,
lifts everything,
lifts everything, and actually it helps align the baby with the cervix and the pelvis, but it also decreases the pressure on the low back, and and it supports the uterus, so they have less of that round ligament, which is like the lower abdominal pain. You know, because in pregnancy there's this there's pressure on the low back, right, from the belly. And from the, all the changes in growing belly and all the changes in pregnancy. So sometimes it's just a posture awareness, right? Some people benefit from a homeopathic remedy, for example, but usually I really think that it's supporting chiropractic care and massage.
I just wanted to add to that, back to our example, if anyone's having low back pain or pelvic pain or abdominal pain, what I really find is key clinically is balancing, you mentioned, massage therapy, but those adductor muscles, those muscles of the inner thighs.
Yeah, muscle strengthening, that's the word I was talking.
You mentioned yoga. So there's the child's pose. I find that it's very comfortable for women, especially if they're carrying, as the baby grows, their belly's getting bigger, getting into that child's pose and doing a little bit of that hip rocking, it takes a lot of pressure off of the low back. And it really lengthens those adductor muscles. Furthermore, just to drop one more thing in there, Epsom salt soaks are your friend, because
the baths. Oh, absolutely, right. And I think also a lot of women today are super busy and they overschedule themselves and they're overdoing it. And so it's either prolonged sitting on a computer, which could be a problem. Definitely is. They say sitting is the new smoking. Or just, being, just running around and not taking time to slow down and relax, having a lot of stress in the body. So I really work with women to process emotions and to try to activate their calm and ground themselves as much as they can, take time for themselves. And it's just okay to cross, like most things, off your to-do list. Listen to your body, is really trust your body. It doesn't lie.
Well, Ann, thank you so much for joining us here on the Facebook Live on the Michigan Family Wellness Podcast. You mentioned it earlier, but tell our listeners, tell our audience, where can they go to find more about you?
So my website is homesweethomebirth.com. So if you go to homesweethomebirth.com/gift, and it has 154 of my favorite resources to support a woman pre-pregnancy, in pregnancy, birth, postpartum, breastfeeding, dads, siblings, beyond, women, inspiration, health. Yeah, but really a holistic lifestyle, how to embrace a holistic lifestyle, and positive, empowering birth stories and books and movies and supplies.
Well, again, we're all about creating and cultivating and supporting the women in our lives, specifically during pregnancy, because that leads to the cultivation of thriving families, and that's what we're all about here at the Family Wellness Clinic. I want to thank you so much, Ann, for joining us today.
Thank you.
Awesome.
Pleasure.
Have a good day. We'll talk to you soon.
All right, families, what'd you think? We'd love to get your feedback. If you would like to email me about anything you've heard on this or any previous edition of the Family Wellness Lifestyle Podcast, you may do so by writing Dr. Kyle at MichiganFamilyWellness.com, and take full advantage of the Family Lifestyle Audio Library at MichiganFamilyWellness.com. Connect with us on social media at Michigan Family Wellness. Thanks so much for tuning in, families. Have an awesome week, and remember, we can do far more together than we could ever do apart.
Now that you've been equipped with the latest in family wellness solutions, we want to encourage you to apply these strategies right away. But the thing is, there's still so much to learn. Connect with Dr. Wallner's Chiropractic and Nutrition Office by going to MichiganFamilyWellness.com and click the newsletter sign-up button to join the informative and supportive community of chiropractic wellness. You will also receive as a gift from Dr. Wallner a copy of Michigan Family Wellness Solutions. an invaluable resource containing dynamic tools to elevate family health and vitality. Michigan Family Wellness wants to thank you for being part of today's podcast. Please subscribe to our podcast on iTunes and give us a 5-star rating and review.